to administer secondary IV medication, IV medication through secondary IV bag. Okay, so we've already compared our MAR with our physician's order and they match, so we're good to go. I'm just going to do hand hygiene really quickly. Our patient is Watson William. He's born on June 14th, 1983. He's allergic to shellfish. We're going to be giving him ampicillin today, so 1 gram dose, and we give this medication every 4 hours. And the route is IV. The time is to give it now, 12 o'clock right now. So we've picked up our PDM, okay, and we can see ampicillin, it is the correct PDM. Ampicillin is the alternate name, so it's an antibiotic, it's a penicillin derivative. We can see that the maximum single dose is 2 grams, so we are well under that. The maximum daily dose is 12 grams. We are also well under that. If we're giving it every 4 hours, that's 6 times a day, times 1 gram, so that's 6 grams, which is fine for us. Okay, so it's supplied as a few different doses, and we've chosen the 1 gram, which suits our needs perfectly. So here is our vial. Okay, so ampicillin, 1 gram every 4 hours, and the time is now IV. Okay, so we're going to need sterile water, 3.4 milliliters to reconstitute it with, and we're going to have a 250 milligrams per milliliter concentration and a final volume of 4 milliliters. Okay, so we're going to choose, so this is our label that we'll use soon. We're going to choose a 50 milliliter normal saline bag.
So I'll first lower the primary bag.
How much time is left?
My primary bag, I can
okay.
spice my
So yeah, we're just going to choose the 50 milliliters with the 1 gram dose. We can either give 50 or 100 milliliters of normal saline, which is the preferred one, or we can give D5W. So we're just going to go ahead and choose the lowest volume because there's really no need to give him like an excess of fluid. We're going to administer it over 10 to 15 minutes, and I'm going to choose 15 minutes. Okay, so it's compatible with normal saline, D5W, lactated ringers. We're not too worried about heparin, potassium chloride, insulin. We can expect rash, urticaria, diarrhea, anaphylaxis, and hypersensitivity reaction. And yeah, so that's everything. And it can be given by a student nurse, so we are good to go with that. Okay, we've basically already done our first check. So ampicillin, 1 gram every 4 hours. The time is now. They're allergic to shellfish. We're going to check that out when we go in. And the route is IV. So we're going to reconstitute our medication now.
make sure it is half full.
Okay, so just to do some hand hygiene.
After that, I'll make sure I label my line, secondary line. Then I can set my rate.
Okay, so that's for 30 seconds. Let it dry for 15. This is 30 seconds. Let it dry for 15.
Then total volume is 100.
Okay.
Then I'll set the cold bath.
We have a blunt fill needle, which we'll say that is packaged and has not been opened yet.
Now I'll watch for 3 drops.
And same with our syringe.
3. After watching that, then I can
So we're going to wing it back like
my
so.
initials and my destination. After
Pick it
that,
up
then
carefully.
I'll do my exit safety check. There's no fluid on the ground. All the lines are connected well. Then the patient is comfortable.
Sterile to sterile is sterile.
This space for the within it. Then I'll
Okay, so we're withdrawing 3.4 milliliters.
program the pump to flush 15 cc.
So 3.4 milliliters of air is going in here.
It's also flowing in.
I'll make sure it's not expired. It's the integrity of the safety is not compromised. Then I will
10.
I'll full swap and then I'll full swap. Lean it for 30 seconds. So I'm gonna write 15. Then I'm putting it at the end of the table.
It may be the
Making
best.
sure I don't contaminate it.
Okay, so 3.4.
But this one forward. Can be equal like
Roll it back gently so that it doesn't form any.
So
It doesn't form any point.
this was placed here. We'll say that it wasn't placed there because this way we still know that it
Label
is
says patient's name.
sterile.
Sodium, 2.5 units. Normally might get 2.5
Okay.
ml. And the delivery one is 100 ml. Concentration per ml is so the total.
So we're just gonna swab this again for 30 seconds.
4 ml in this one.
If I was concerned that this wasn't sterile anymore, I wouldn't use the cap.
Rest of the supplies will go in the patient's room.
I would place my needle on some
then my
swabs.
secondary tubing, and then yeah, that's pretty much it. And we while going hand hygiene, while going into the patient room, doing a quick safety check, making sure that was in those positions, all was in
Okay, so
no
scoop
signs of
method.
or hazard on the patient face. Bed was in those positions. Hi, my name
Roll
is
it
Shanka.
gently.
I'm the nurse for today.
We should have 4 milliliters, but we will have maybe less than 3.4.
Before that, can you please tell me your name? Your age? Can you please tell me your date of birth? 5 minutes. Can you have a look?
7 minutes.
Thank you.
7 minutes.
Trying to get every last drop here.
Can you please tell me that you have any allergies? No, that are your so you have shellfish allergy? Okay, I'll keep that in mind. Thank you for that. So before doing anything, I would like to do my the third check, I'll grab it. It says here, Erica, here,
So now, after reviewing my patient, my doctor's order and the mark is double signed by the patient, by the doctor and the nurse. So I can now go compare my patient's information with the mark.
Okay, so
I have the same dose
3.3.
So
So we'll say that that's 3.4. We're gonna do our second check now. So right patient, Watson William. Okay, drug ampicillin. Right dose 1 gram, 1 gram. Right frequency every 4 hours. We're going to give it right now. The time to give it is now, and the route is IV. Okay, so we've gone ahead and prepared a label here, which I'll show in a second. So I'm going to swab this for 30 seconds, let it dry for 15.
Initial dose is 2 to 4 millimeters. I'm going to dilute it into 3.1 ml. Then total volume will be 5 ml. Concentration of
Okay.
per ml. Then
This is going to go to the sharps now,
100
and
normal cell because my patient
our
is
label
dehydrated, I want to give them more fluid.
goes
So
on
now
here.
inside for about 30 minutes. So my first time for my client to get this medication and to administer for the long.
Okay,
Then it is still
so
compatible with the normal cell in the
okay,
primary
just
bag.
going to
Hazard is congestive
take
heart
our
failure,
more, our medication, our tubing, or medium is not really necessary to bring anymore. Put that away. So I'm going to enter the patient's room now, perform hand hygiene. I see that they're not in any distress. The bed is at a low level, nothing on the floor. I'm going to introduce myself. Hi, I'm Alex. I'll be your nurse today. Can I please get you to state your name, your full name, and your date of birth? Okay, so Watson William, June 14th, 1983. June 14th, 1983. We see that everything matches. So I see that you're allergic to shellfish on here. Is there anything else you're allergic to? Nope. Okay, great. Okay, so I'll be administering ampicillin to you for you today.
I'll recap my three.
Has the doctor talked to you about this drug? Have you taken it before? Okay, so this drug is for your cellulitis, the infection in your arm, or in your leg, whichever it is, the infection that you have. And it's meant to kill the microbes that are growing in there. So you can expect, at worst, rash, urticaria, diarrhea, anaphylaxis, or hypersensitivity reaction. Most people tolerate it well. So I'm just going to check your IV site. There's no redness, there's no infiltration. Everything looks healthy here. Does that hurt? Is that sore at all? No, you're good? Okay. So this is not clamped. The system is running properly. I don't have a primary rate written on my MAR, but if I did, I would check to make sure that it is correct over here as well. Okay, so now I'm going to, what time is it?
11 minutes.
I'm going to connect my system here.
Right now I can go ahead and do my
So, going to first place this down. So I'm just opening this right now. I didn't open it prior. We'll just pretend that. Okay, we're going to swap for 30 seconds. Let it dry for 15. Okay, we're going to pretend that this is sterile. This was on it earlier. So we turned our back, and now we're not sure.
So after reviewing my documents, I can go ahead and
Okay. So swap for 30 seconds, let it dry for 15.
I'll pick 100 milliliters.
This is sterile to sterile, so it's okay.
Then I'll
Okay. This is clamped, so we're not going to lose any medication. This is also sterile. We're going to pretend that this was on it already. It came like that. Wasn't on it. Just going to squish some medication in the chamber. Put it up higher. We're going to say secondary. What time is it?
12.
So we're going to follow our label here. We have a volume of 54 milliliters.
Then I will go back and document the medication part that I have given it with my time, with my
And we want it to be at a rate of 216 milliliters, so that's okay. We're going to confirm the secondary. We're going to unclamp it. Oh, and we also need to release the air. Please work.
My name is Avin Okumo. I'm a student. So I have to identify my patient.
Come on.
So right patient.
So it's It's not working.
After I'll go to my health check.
I'm not sure why.
Right
Okay, so we're gonna pretend that I was able to get rid of the air in there. And I'm going to be watching for the 3 drops in here to make sure that my medication is infusing. I'm going to let my patient know that I'll be back in 15 minutes to make sure that the primary is going to start up again. And I'll give them a call bell. I'll make sure that they're comfortable and reassured, and going to perform a safety exit check. So nothing on the floor, they're not in any distress. Yeah, and I'm going to document on my MAR with my initials and my designation that I'm a student. Sign it, write the time. I'm going to maybe document the fluid status sheet, or whatever it's called, just to say that we've given him this fluid.
The side effects with this medication from the sleep bacteria, electrolyte imbalance.
So I let him know.
So in case of any side effects,
Right, so the tubing,
at this point the patient has the right
secondary
to
tubing
take the medication, but the patient doesn't take
as well.
the medication. So right now I can go ahead and administer my medication. So I'll lower the
We wrote the date and the time.
after my primary
We would have checked that the primary rate is running at the rate that the MAR states, the correct rate. That should be everything.